Well, back with Dr. Preece in Anchorage from Alaska. So, Dr. Preece, we talked about missing teeth and how they can affect the life with headaches, neck pains, looking older, all kinds of things. Now, what are some of the methods on how to replace missing teeth? I know there's lots of new methods out there. They're really as good as they're cracked up to be. Is there a solution? Can it be permanently fixed? Yes or no?
Yes, there are several options, and basically there are three options. One would be dental implants. A second would be fixed bridge work, and third would be removable partial denture type replacements. And they each have their advantages, their pros and cons. The one that's becoming more popular all the time and is becoming the treatment of choice is dental implants. That's because you don't have to affect any of the other teeth in the mouth, and they're very natural, and you can floss around them, and once they're in there, you don't even know that there's anything in there but your natural tooth. And they look natural, and they're very permanent. So that's becoming the treatment of choice for people who have enough bone to do that and can afford it. That's very popular.
You say affording. Is it really all that much more expensive than, let's just say you need to replace one tooth with an implant versus you do that, or replace that one tooth with what you call a bridge, where you basically grind down the two teeth next to it, put a crown or a cap on it, and have a third tooth hanging in between. That's why they call it a bridge, like the Brooklyn Bridge.
Right.
So, you do 3 teeth, and you do 3 ceramic crowns versus one. Is the price really that much more? And
no, it's very similar actually. Usually in the same ballpark is the 3-unit bridge. So it's usually 6s.
Okay.
Yeah.
And isn't there then the factor, well, I don't know whether it is, and I want an answer from you, that a bridge, while it is a good thing and has served the purpose well for decades, I think, while it is a very good thing, it does fail on an average at least in half of the time than an implant, more or less on an average. I mean, there's no complete statistic, but on an average, an implant seems to be lasting pretty much the rest of the life, because, I mean, people usually get it around 30, 40, so it kind of lives it out, where yet a crown or like a bridge doesn't quite last that long on an average. Is that true?
That's true. The bridge puts stress on the adjacent anchor teeth, and it's harder to clean around a bridge. It takes more effort on the part of the patient to floss underneath the bridge and keep it clean, and there's more chance of getting a new cavity around the anchor teeth with bridge work. So overall, I think the implants are a better way to go. They're easy to floss around, and you don't affect the adjacent teeth that way.
Right. Well, and if it does fail, let's just say half of the time, even if it's not quite half of the time, but if it's then you have to redo it again, that just then for sure X's it in terms of price versus an implant, right?
Exactly.
So you may be saving a few dollars at the beginning and add then a whole bunch of app on it a decade later. Never mind, you said something very important here. You said and then I can see that because, I'm one of those guys who, just like with eating, I'm done before my wife starts, and same with, let's say, brushing and flossing. My wife is still brushing and flossing while I'm finishing with showering, with shaving, and with talking a half an hour garbage. She's still on her first tooth. So I can see that lots of people probably are a little bit like me, seeing the importance, doing it, but being a little lazy, being a little slappy. And if that now it becomes difficult to floss a tooth, because when you have a bridge, you have those 3 or 4 or even 5 teeth all together. And and you can't floss in between, which means, as you said, they build up for a disease to keep your poppy seeds in it, and then they start getting rotten and a little chicken, and now all of a sudden you get a gum disease in that area, which I guess is what makes the bridge failing more easy. And wouldn't you then still get that feeling of decayed, like almost like you don't have a doof? The doof can be lost because there is no doof there, and you get the caved-in tomato, dried-out tomato-like look. Maybe not as bad as I described it now, but in that direction. And wouldn't it be, kind of having that infection? Wouldn't that kind of like be bad on your immune system and everything, because literally you're poisoning your body because you have an infection there?
Right, exactly. Periodontal disease is a chronic low-grade infection that can affect many other parts of the body, especially the heart, they're finding. So anytime you have a chronic infection, it's not good for you. It saps your energy and lessens the immune system everywhere. So that's
and
a good point.
Having a crown, while it is a very good thing, while it keeps the teeth straight, while it gets you chewing, while it doesn't put you, make you all that uglier because it doesn't move the other teeth, it does open the door for such a gum disease a tiny bit more. You don't have to get it if you're like my wife, who is willing to floss a half an hour, but if you're not, you might potentially have a problem. Is that what it is?
Yes, that's true. But I need to mention here, though, it's still possible to get gum disease around an implant. They're not impervious to that. So even though you do have an implant, you still do need to maintain good oral hygiene, or you could possibly have a problem around that eventually also.
Of course, but it's slightly easier because it's like your normal teeth. You don't need to have those little needle, the thread to floss in and to go out.
Yes.
It's part of like the normal maintenance. It's slightly easier.
Exactly. Yep.
Well, thanks a lot, Dr. Preece. I hope this helped the people watching it out there of what can be done. We didn't yet talk on the partial and all that stuff, but we take that up on a different little section. Bye-bye.
Sure. Thank you.